Here with us now, primary care physician, Dr. Saju Mathew. Doctor, welcome. The point that Secretary Kennedy is making there, what's your view on it, that we should be focused more on these chronic diseases?
You know, hey, Connell, I would say we should focus on both. Both of them are threats. And I have to say that I agree with Mr. Kennedy when it comes to chronic diseases. I mean, we're ranked number 60th, I think it's 63 in the world, behind other high-income nations when it comes to life expectancy. We are behind Australia, Canada, and most European nations. You know, 6 in 10 Americans have one chronic illness, 4 in 10 Americans have 2, and in the next few years, over 84 million of the population in the United States will have 3 or more conditions. And, you know, Connell, I am seeing, unfortunately, a rise in cancer in young people, 30 and 40-year-olds. So he is 100% correct. We need to address this issue before we start losing more and more Americans to chronic health disease.
So what do we do about it? Well, RFK Jr. did speak about that last night as well, saying what he's doing at Health and Human Services. Here it is.
What we did is we're streamlining the agency and we're recalibrating its trajectory so that people there are narrowly focused on one issue, which is how do we end the chronic disease epidemic.
All right, so what would you say about that, Doctor? I know Kennedy, again, and people have opinions on him because he's been around in public life for so long and has controversial positions on certain issues. But on what he's talking about here, think he's on the right track?
Well, he makes total sense. You know, I don't necessarily agree with everything that he says, but when it comes to nutrition, eating healthy, he's probably one of the fittest people that I've seen on TV, and he practices what he preaches. Yeah. I mean, he is correct about the way that we eat and, you know, how stressed we are and chronic illnesses and how you can't watch TV without some type of a commercial on GLP-1 agonists and Ozempic. And I'm in the trenches, Connell. I know that it's difficult to get people to eat differently, but somebody needs to talk about this. And diabetes doesn't develop overnight. These are chronic conditions. So I absolutely agree with him, but measles is a threat as well.
So you want to do both. There was the fluoride thing. There was the dye in the foods. By the way, on fluoride, there was the AG in Texas just put something out. They're going after fluoride in toothpaste. So there's the article on Paxton. Any opinion on all of this, or do you just got to take it on a case-by-case basis? You know, what's in our food and what ingredients are in some of the other things that we use?
Yeah, I mean, you know, ultimately, Connell, every situation has to be taken on an individual basis. You know, what we put in our mouth can actually cause diseases, like I said, cancer and heart disease. You know, I'm not 100% in agreement with the fact that we have to find the exact cause of autism, and autism is not caused by vaccines. You know, we need to spend more time making an early diagnosis, because the earlier that we make the diagnosis for autism, the better that we can help our children, you know, cope with this debilitating condition. So there are a few things that I'm not 100% sure I agree with him on, but on this particular segment, when he talks about chronic health diseases, he's 100% on point.
Okay, good balanced discussion on all this from someone, as you said yourself, you're in the trenches. So we thank you for coming on today, spending a few minutes with us to explain it all. Thanks, Doctor.
You bet.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.